Blood is, seen traditionally as the first treatment for anemia. If you think that blood is like a transplantation, why for blood failure we use transplantation as the first option, but instead for heart diseases, for liver diseases, transplantation is the last option. You have diet, you have nutrition, exercise, lifestyle, then you have checkups, you have management, detection of the disease, treatment of the disease, and so on, and you finally arrive to transplantation. But for blood health and for blood failure, the first option to treat patients is to use transplantation, blood transfusion. It was very frustrating that many of the surgeries were delayed, postponed, rescheduled because of the lack of blood products. I was stressed also when I had to have some interventions or giving birth. And this was the first problem that I faced.
Every day I see patients who are anemic, a hemoglobin of 8 or 10 or 9. Why was this just ignored and accepted?
It was estimated it's affecting almost 2 billion people all over the 1.9 billion people are affected. 30 to 60% of people coming to surgery globally are anemic.
If you look nationally in the United States, the incidence of preoperative anemia, according to some of the research we've done, is over 20% for patients coming for surgical procedures, pediatric patients. So not only is it a preoperative anemia in pediatrics a problem in lower and middle income countries, but also in high income countries too.
I would guess around 60%, more than half of our patients, maybe up to 70%, are anemic to some degree before coming to cardiac surgery. If they had been seen prior to and diagnosed, then they might be able to prevent that anemia prior to a big surgery.
Patient blood management is a way to promote blood health. You can see it on the title of the recent WHO guidance for patient blood management implementation for blood to reach blood health. Patient blood management is about patient safety. Can improve the outcome by simple, in my opinion, simple but so difficult to implement, treating anemia and being more thoughtful when you have to transfuse patients.
It's very important that anesthesiologists be aware of this because they are the persons who see the patient prior to the surgery, and they are really the perioperative physicians. We always say that anesthesiologist is not only for putting the person at sleep, he is the most important perioperative physician. So he has to take care of the whole problems of the patients.
I think anesthesiologists have this really unique perspective because we are intimately involved in all aspects of blood health, and not just in pregnancy care, but in normal surgical care. So we kind of are the ones who are responsible for checking laboratory values, for example, for deciding whether or not someone needs an intervention to support their blood health, to monitor blood loss during an operation or during a delivery.
Small children and women had a higher prevalence of anemia. I'm so happy that now anemia management is part of maternal health topics. The first cause is nutritional one, and iron deficiency is the most important cause of anemia.
In my own experience, I had no idea, like many women, that I was anemic. September 11, 2001, thousands of people in the U.S. went to donate blood because they felt helpless. I found out in that moment I couldn't donate because they said you're anemic. I was early 20s. I was running 5 to 6 miles a day. I went to my primary care provider who said, your hemoglobin level is around 7. I had no idea.
The people, patients, they should be aware of the risk of anemia. So they should be aware that when they do their regular checks, they should ask for, simple tests to detect anemia and ask their doctor, look, doc, I'm anemic or not, what I have to do. Empowerment means that if they are educated, then they can be part of the decision of the treatment. In the past, it was shown that this obtaining only a paper signed for the patient doesn't mean that the patient understood all the explanations or all the risks the physician presented to them. And now we are talking more about the shared decision, making a decision together with the physician. And this means that they need more information.